I see it says live.
Hello, good evening, everyone. I'm Shaneri Eze. Yep, we are live here at Eze Health Center. We have Eze Health Live. Tonight we are talking on the subject of community wellness. I am so pleased to be joined by three amazing guests. We have Ongisa McKenzie, Dr. Richard Cook, and Miss Shawna Mayon Marks. Welcome.
Thank you for having me.
For having us. Thank you.
All right.
Thank you.
Absolutely. Absolutely. So, a lot of important issues to talk about this evening in community wellness. I'm a big believer in seeing health and wellness from a holistic standpoint. So, it's more than just someone's physical health, but we're looking at their environment, their mental health, emotional, as well as relational. So, we're going to touch upon all these issues. But first and foremost, I want each of you to kind of introduce yourselves, tell us a little bit about you. And I understand everyone here is also political candidates for local government here in Charles County. So tell us a little bit about you and also why you. We'll start with Ongisa.
Why we're running for office, right? At the end. Is
Yes,
that what you
tell
said?
us a little bit about you as well.
Oh, okay. So I'm Ongisa McKenzie, or Ongisa Ichile McKenzie, the whole thing. I'm the founder of Southern Marylanders for Racial Equality, and I'm also a former teacher. I'm currently a realtor as well. And I'm running for commissioner in District 2, which is the Bryan's Road, Indian Head, Marbury, Nanjemoy area, generally. And I work on equity issues and a range of topics from health to education, voting, um, policing, um, and in a lot of different areas that we really need because it's just so critical for us as people of color to have equity um, because those equity issues have a significant impact on our mental health as well as our physical health. So I'm really glad to be here with all of you very smart people talking about these topics.
Absolutely. Dr. Cook?
Yes, thank you for having me tonight, Shanieri, and thank you for putting this forum together and your service in your community. I think we are all very community oriented people. We help out and uplift our community through various endeavors. Mine mainly is through medicine. I'm a board certified internal medicine physician, been practicing for 20 years. I live and own a private practice in Waldorf. Excuse me, I live in Hughesville. I own a private practice in Waldorf. And one thing I love to do is give back. I have been blessed to be where I am, and I want to try to bless as many other people I can through health and wealth. And that's why I'm running. One of the reasons I'm running for District 1 County Commissioner. So remember this slogan: Who can, cook can.
Again, I
Yes,
remember
yes, sir.
that's memorable.
All right. And Miss Shauna Marks.
Good afternoon. Thank you for putting this together and having me. I truly appreciate it. My name is Shawna Mayon Marks. I am a mom of three. My oldest is 22. She just graduated from CSM. She graduated about 4 years ago from St. Charles High School. I have a 14-year-old. He goes to La Plata via Stedham at the Virtual Learning Academy. And then I also have an 8-year-old, and he goes to Walter J. Mitchell. I'm also the founder of Charles County Moms of Color, the co founder of Maryland Moms of Color, and I'm also one of the founding members of Charles County Rise. So I decided to run for school board at large because I saw some things in our school system that I felt were not good for our kids and things that we need to change. One of the things is, recruitment and retention of teachers, diversity, and also we have a huge bullying problem, which I'm glad that we'll be discussing that today. So I look forward to speaking with all of you. Well, I'm just excited to be among you all because you guys are very influent in the community and doing some amazing things. So thank you for letting me be a part of this.
Awesome, awesome. I'm so pleased to have you all on. And I specifically chose each of you because I know about the work that you do in the community. I know the passion behind it, and that you genuinely care and want to make a difference. So thank you all for joining us tonight. So we're going to actually jump right into it. We are living in very difficult and challenging times from all aspects. Um, I mean, we're currently still in a pandemic. We have an economic crisis, a recession, inflation. We have levels of mental health issues. I mean, it really runs the gamut. It's like the worst of all things happening all at one time. So it's really critical that those who are in influence are making good decisions and in the right direction. When it comes down to community wellness, it goes beyond just individuals their own families, but how what's going on in those units and with those individuals is impacting everyone. It's not any one person kind of on their own, and whatever happens to them only affects them. It affects everyone. So, I mean, we see a prime example of this with the pandemic. It hit us in 2020, and we are in 2022 and still experiencing the effects of it. And we're literally still in the midst of it. Just to give you a couple of statistics, according to the CDC COVID-19 data tracker, the COVID-19 infection has or infected 84.4 million people in the US. And now we've surpassed 1 million deaths. So this is something that, even if you hadn't caught it up until this point, it has impacted your life to some extent, a family member, friends, co-workers. It's something that we've never seen in our time. We're still experiencing in the midst of it. So my first set of questions are for Dr. Cook. I know you being a professional, you're on the front lines. I also, as a medical provider, have seen the direct impact of the pandemic on patients. So in your opinion, how has the pandemic impacted public health at present?
How has the pandemic, what public health? I'm sorry.
Impacted public health.
Impacted. Okay, gotcha.
In-
So I think the best way to answer that question without being too in depth is to understand that your health is your wealth. That's the bottom line. And what I mean by that, you can see in numbers, real time numbers, and basically real time what is going on with the economy. I mean, think about you order something apart from an auto store or a dishwasher or whatever, and someone tells you it's backlogged. Well, it ain't backlogged because of Putin and Russia. You know, it's not backlogged because of the GOP or something like that, even though we can talk about them for a while. But we are having issues because of COVID. COVID affects everything, whether someone dies and can't work because they're dead, or because they have chronic COVID and can't work, or because they're in the hospital for a week or three and can't work. You know, we've been studying the healthcare of the work related healthcare um, incidents and how it relates to loss of money for decades. And if you look at all of the other developed countries on the planet, you'll actually see that for mainly a couple of reasons, they've all implemented universal health care, and that's disease in war. One thing that a country knows is if its citizens aren't healthy, it cannot defend itself. And the other thing is if you have a bunch of people who are sick, your economy goes to trash. And we've seen that in real time. And some people still don't get that. And that's been a pretty um, a pretty integral part of certain groups of people who are actually living in real time through this pandemic and fail to believe what's right in front of them. And of course, we can go into disinformation and misinformation campaigns, but you know, you're a practicing a physician assistant as well, and I'm sure prevention is a huge part of your practice. And one of the things that we always tell patients is your health is your wealth, and prevention is key. So the last numbers I looked at were that had we handled the pandemic correctly, or even had a universal healthcare system, we wouldn't have lost about $16 trillion. So, bottom line, again, your health is your wealth. You got to prevent things from happening, which, infectious diseases are pretty easy to do. If you let them run amok, your economy is going to run amok, your military is going to run amok. And of course, the worst thing is people are going to die and people are going to get sick. Your hospital systems are going to be overwhelmed. People are going to get burnt out. Nurses are going to leave. Doctors are going to leave. Teachers are going to leave. It's a cascade and a snowball effect, and none of it is good. And this is what we are seeing in real time.
Absolutely. Yeah. And you mentioned earlier about prevention and how to be, us being proactive. I understand there was even a plan on what to do in regards to the pandemic before it even happened, but many of those initiatives weren't even put in place. There was the disinformation campaign, which we know definitely impacted the outcome. People just not believing in it, not wanting to take those precautions, more willing to kind of experiment on creating their own cures for it, and which had some pretty bad, effects as well. Now, another thing that we've seen as a result of the pandemic, or what it has revealed, is that there has been these great disparities when it comes to chronic disease and healthcare across racial and social economic lines. So what is your comments on that in regards to, the pandemic has exposed these disparities in healthcare?
Yeah, I guess if anything's positive about this pandemic, we do learn something if you're looking at the right information and not the dis and misinformation, as you've eloquently stated. Bottom line is that, and unfortunately, it pains me to say this, but I speak truth. Racism is as old as American apple pie. But it's not just America. We see and we've seen health disparities throughout all countries on the planet, and it doesn't just permeate African Americans, but people of color in general, Asians, Hispanics, Arab populations, and so forth. And they've studied this all over the planet as well. But I know we're specifically talking about the U.S., and there are many instances that the pandemic drew attention to, and they were studied very well. And I pulled up a couple of data points for everyone just to tell them some of these disparity numbers. But in the U.S., African Americans were 3.57 times more likely to die from COVID than white people. And that data also permeates through the world. Not only that, but we tend to have more of the risk factors that increase our predisposition to getting COVID and other infectious diseases. COVID just highlighted that. It's been going on for a long time, like blood pressure, diabetes, and obesity. And I'd like to strongly point out that these are not genetic factors. Just because you are African American living in America doesn't mean it's genetic. It's mostly social economic. And of course, it's the old white supremacy of the nation. We don't get treatment like others for certain things like pain. We don't get prenatal care like others, which means we have a higher mortality rate for babies. We tend to have more mental problems because of lack of social services. We tend to get less vaccines because of the distrust of everything else I just mentioned. And we did see that, of course, during the pandemic. I would like to say one thing that, because I was definitely on the front lines. I vaccinated, treated, tested thousands and thousands of COVID patients, and it was great to see after years of recommending vaccines to everyone, including African Americans. But we were a group that didn't like to get vaccines. That a lot of African Americans who didn't used to get the flu or the pneumonia shot or the Shingrix shot or the Tdap or whatever, a lot of them did get the COVID vaccine, which was nice. And I think the reason is because of conduits like this, like you're doing right now. They see us, we look like them, and we give them information that makes sense, and they see it in real time, and they trust us. And that's actually what you see in the numbers. We are very much more trusting of African American healthcare providers than we are of anyone else, because we trust us more than anyone else, because we have a better track record with ourselves than anyone else. That's proven too. It's proven over and over and over again. And I'm very happy of that fact. So COVID has mostly bad things, but it definitely highlighted some things that we could make better. And I think it definitely did help out. People got a tutorial on 101 science in infectious disease with COVID. And hopefully this type of history stays learned and stays taught, so we don't forget it like we do with some other forms of history.
Yeah, absolutely. I think the pandemic has definitely exposed these disparities. And now that attention is being brought to it, at least some initiatives are being made to close that gap. Speaking of how racism has such an impact on our overall health, in April 2021, the Centers of Disease Control actually declared racism as a public health crisis. The very reasons that you mentioned, disparities in access, lower quality of healthcare, bias and prejudice within the healthcare system when it comes to providers. So there's still distance of racism not only affecting us socially, but physically, even because our actual health is being impacted. So my next set of questions are for Ms. McKenzie. Um, Understanding now that racism is being recognized as a public health crisis, in what ways does racism impact a person's health and well-being? I know in your line of work, you've done rallies, you've done protests, you've been very active within the social justice realm. In what ways does racism adversely affect us?
Well, racism affects us at every turn. So we're seeing everything from medical students who 50% of which believe that Black people don't even feel pain. And they're treating us, a majority of our doctors are not like you all. You all are unique in that most of the doctors that we have a choice of are non-Black doctors. And so being that they have these stereotypes, these are the people who are treating us. Sometimes they're under treating us. Sometimes our symptoms are ignored. But also the racism that we encounter with stress level. And, I went to a museum with my children a few years ago, pre-pandemic, and we went to an exhibit about, I think it was at the new Smithsonian for African American history and culture. And it was talking about the difference between continental Africans and Africans in the diaspora, specifically in the United States, and how even continental Africans who move here have higher rates of stroke, higher rates of hypertension, higher rates of cardiac disease, because the extra additional stress of racism that they face. And I could say that firsthand because my father is Nigerian. He's an immigrant. He's lived here since the 70s, and he did suffer a stroke several years ago. And I know that we're coming from a family where people pretty routinely live until their 80s and 90s. You know, both of his parents, lived very healthy lives. You know, walking up and down mountains until they were 88 and 94. And so for him to have a stroke in his late 60s or whatever, in his 60s, it shows you the stress. And I know for a fact that he fought racism from the workplace. We're fighting racism on behalf of our children when they go to school. We're fighting microaggressions in the office. So not only that, but we're fighting as parents when we have to have the talk with our children, and when we have to worry about their outcomes as well as our own outcomes. So it's definitely a pandemic that is exacerbated by all the institutional racism that we face. Socioeconomics is an indicator. Of course, we know that people of color are more likely to have worse socioeconomic status or lower socioeconomic status. Food instability is an indicator that can affect mental health. Housing instability is an indicator that can impact mental health. So when you look at all of those factors, right here in our own county, we're dealing with areas in this county that have abject poverty, a very high rate of schizophrenia in some parts of Charles County, very high rates of just people experiencing major depressive disorders in this county, largely untreated, and probably largely undiagnosed as well. So when you have Black people who don't trust doctors, Black people who definitely don't seek mental health care, you have a lot of criminal, quote unquote, criminal behavior that could have been prevented. And so, yes, it permeates every aspect of our lives.
Absolutely. So
Can can I jump?
understanding how racism is just beyond. Oh, sure. Go right ahead.
I just um so last year I started Charles County Moms of Color, and there was two reasons why I decided to start this group. And I went back and forth for like a month, like, do we really need it? Because we have another Charles County Moms. But somebody, I believe it was a Black lady, asked, did anybody know any Black doctors? That was the question. And Agatha probably remembers the question.
Yeah.
And so people were telling her, but then a white lady was like, well, does anybody know any white doctors? And they were like, you think it's a joke, but it's not a joke. And, the Black ladies were trying to educate her, like, look, this is what happens. We have a higher maternal health issues. This is why we seek out Black doctors. And that was the reason. Like, I was like, okay, it's true. Yes, we're all moms, but our lives are very different. And, I remember when I was pregnant with my son, they were like, oh, yeah, we have a doctor in La Plata. And I was like, a hospital. I was like, I'm not having my baby there. I drove all the way to DC, and I had a Black doctor because I felt comfortable after researching it, because my life, I know the risk of having children, and this is long, long going on, because when my mom had me, she had a stroke. And it was my grandma that advocated, like, something's wrong with my daughter, something's wrong with my daughter. And they were like, oh my God, yeah, there is something wrong, but they had ignored it. So, when we try to educate some people, they're just like, oh, whatever, just go to a doctor. And it's like, no, I need a doctor that's going to listen to me and that understands my body, and that, yes, I do feel pain and that does hurt, or this is going on. And, when she made that post, and it was like, okay, you just think we're a joke. So, this is not a joke. There's a reason why we search and look for doctors that look like us, even if it's high, have to search high and low, and it's a little bit easier being here with other educated people in this area. But I used to live in Wisconsin, and I couldn't tell you if there was a black doctor or if I ever saw a black doctor, because it was not very common. We lived in a condo, and we were the only black family. So that's all I wanted
Mm,
to add.
yeah. And that happened. Representation matters at the end of the day, especially when it comes to health and wellness. I think that shared experience, that shared understanding, that shared culture does in fact matter when it comes to that. There's uh, as much possible, likelihood of prejudice and bias when you have a healthcare provider that understands you. So these things do matter. So even when it comes to things like social justice and addressing criminal justice in our communities, how we as a people are viewed um, from the lens of law enforcement,
Right.
and how that impacts our lives. Uh, I know in New York when they had the stop and frisk, and how
Mhm.
many African Americans were pulled over in these type of systems versus other races. Even the charges and the sentences for certain crimes were different um, between African Americans and whites. So I know, Angisa, that's your area of kind of expertise. We kind of improve the social justice reform and criminal justice reform. What are that, that you've observed that are problematic, and what are some possible solutions?
Well, the problem with law enforcement we do have here, despite having a black sheriff. I know a lot of people are very, very um, quick to say just because someone at the top is the same color, that means that across the board in a system that's been there for 100 years, that there's no systemic racism. But we had a study that was done by the University of Baltimore law school students, and they were studying us down here in Charles County and how our sheriff's police, and they pulled the arrest data, and they found that there's a trifecta of charges that is up to the discretion of the officers, which is failure to obey, resisting arrest, and disorderly conduct. And so we found that um, out of 10 people arrested, 9 of the people that get those charges would be black people. So that means that
Mm.
90% of the people that were arrested with those charges were black. That's what I refer to as stacking charges. So it's not just, hey, I shoplifted from this store, but now I'm going to add those 3 charges. And so what that means is sometimes, even if the person is not convicted of the initial crime, they will have extra charges so that they can make something stick. And that's really insidious, because you're taking people's freedom, you're interrupting people's lives. And they're not doing it across the board. They're not doing it to white people that they arrest. And so when I gave this data to several people who didn't want to touch it. And it was mentioned to our sheriff in a forum like this, much like this one. And he said, oh, it's just because of mental health. And so, as we can plainly see with mass shootings and everything like that, we are not the only people who have mental health issues. We're not the only people who resist. We've had instances that have been reported to me from attorneys that represent various individuals, like public defenders, that sometimes 2 people of different races will commit the same crime at the same time and get a whole different slew of charges. And so every time we broach these subjects and ask for reform and say, hey, let's check out these charges, let's take a look at this, we're kind of thwarted. That's why we wanted the Civilian Accountability Board, which of course is also being done without much public input. I have no idea who has been selected and why. But those are the types of things that we have to advocate for, because it's our kids going out there. I have a 16-year-old son, He's got dreadlocks. He's 6 feet tall. He's out there, and I worry every day that, because he might not present the same way another teenager presents, or he might not be able to advocate for himself the way another teenager could, those tragedies could befall him. And I know that I share that with several moms. I know that there's some ladies in the comments now who have harrowing stories of their own to tell, that are going through it. Hey, Erica, that are commenting on this live, because it's impacting all of us on some level.
Just to jump
these
in.
are real issues. Oh, go ahead.
Oh, just running a mom's group, you kind of get you see it all. So you see, they went for walking out of class because he got upset. And those are typical things that kids do.
Yeah.
I have 3 of them, and yes, they have gotten mad at me and, like, went to their room. That's just normal stuff, but they want to suspend it, or they want to say, he threatened, the teacher, so now the SRO, or he was playing slap boxing in class or at lunch, and now you want to arrest him. And it's like, what? Those are all things kids do. That's not something you should be arrested for. And we see it a lot. I believe we see it a lot more in our moms group, because they tend to label our kids a little bit more. And even we had an anti-bullying forum, and so if the child is between a certain grade level, it has to go to Dr. Navarro. And she mentioned that the majority of the ones she got, because she has to approve it whether or not they're going to be suspended, were children of color. And we're like, what? When we know for sure that there are, white kids that are calling little black girls and boys the N-word, or totally bullying children over and over, because the parents have told us, the moms have told us, because they're at the end of their rope, because their kid doesn't even want to go to school. And we had a couple incidents where kids were even, harming themselves. So to see that it's all on us, and then we're like, wait, we've seen both sides, but it's just the kids of color that are getting the referrals, are getting asked to be suspended, when and that starts like that trickling of, you're now, the SRO knows your name, so now the police knows your name. And it's like that down spiral effect, like, and now they don't even want to go to school, because they're like, okay, you're just trying to arrest me, and that's not what school should be about. That's all I
Right.
want to add.
And I think that having a mobile mental health crisis unit to go and address people who are, presenting with these issues, maybe they're roaming the streets, maybe they're having delusions, maybe they're threatening to harm themselves. We need someone who is a professional, because law enforcement officers aren't trained therapists. So we need professionals to go accompany them to try to de-escalate the situation ahead of time, because unfortunately, we have not adequately trained police to de-escalate. And one thing that we also need is a police force who lives in the community, knows the community, is not afraid of the community, and who understands these dynamics within the community. Because otherwise, if you are a hammer, everything you see looks like a nail. If you just think of Black people as criminal, you're going to think that you need to approach every person as a criminal. And some people just need treatment. Some people just need an intervention. Some people just need de-escalation. And so hopefully that project will get funded and be properly coordinated with the health department, or whichever mental health professionals they decide to hire.
And might I add something as well? This gets back to prevention. I'm 52 years old, and when I was growing up, elementary, junior high, high school, we didn't have the mental health crisis that we have now. And there are many reasons behind that. But one of the things that we have to implement in our society, in our accounting, is preventative measures. Kids today, they don't learn much about physical and mental health anymore. And that needs to be taught just like math needs to be taught. They need input from day one on how to handle situations and who to go to and who to talk to when those situations occur. We lack a lot of resources to handle everyone at the end of a health crisis. And that's why we have one. But preventative measures, whether they're helping to control your weight by teaching you how to eat right or helping you how to think straight in certain instances and deal with other people, communicate with other people, have to be part of the curriculum like anything else. And if we don't do that, we will be bandaging up everything, and the spigots will be very hard to turn off at that point, kind of like what we're looking at right now.
And let me also add to what Dr. Cook just said. That's a challenge because we should be increasing the social emotional lessons at school. We should be teaching kids about their bodies and about their health. But you see how a certain segment of the population doesn't want us to teach about multicultural history. They don't want us to teach the truth about health. They don't want us to teach. They didn't like Michelle Obama's Let's Move campaign, or that the fact that she wanted healthier food in the cafeteria, because how dare you tell my kids what to eat? How dare you tell my kids? The thing about it is that whenever the school system tries to become a sidearm to the public health system and useful to the public health system, catch the society at its young age, everybody else like rails against it. And unfortunately, that's what puts a halt to all of these useful programs and tools, where if you go to other developed nations, you see that is absolutely throughout. We are going to show you guys what to eat. We're going to show you guys who to talk to if you're feeling down. We're going to show you guys how to take a vacation. Kids in this society and adults don't even know how to take a break. We don't even know how to relax. But siesta is a part of school in Spain. Taking a holiday is a part of being an employee in Belgium. We are literally a society built on productivity and go, go, go until you pass out.
And I'll just add on that. I'm a supervisor. I work for the Department of Veterans Affairs. I've been a supervisor about a year, and I literally just sent out an email last week, and I'm like, "You have this many hours of use and lose. You need to take vacation. You have this many. You need to take vacation, and you have this many. You need to take it." Now I have one girl. She's like, "I don't have no use and lose because I'm going on vacation." But we have ingrained that into us. And I was watching I just like some people like they do the little skits on TikTok. And that was one of the things the lady was like, I'm going on vacation. She was like, oh, no problem. You'll have your phone. And she's like, no, I'm going on vacation. I will not have my phone. Oh, well, I never go on vacation. It was like, that's not normal. Just like, for the longest people, I'm just saying, for the longest people would go to work knowing they sick, they have the flu, would still come to work, sneezing and coughing on everybody, because in our minds is you have to keep going. I can't take sick leave. I have this project due. But now you have the whole office sick and now we're all out. But we just, those are things that need to be taught. And that's why, we have counselors and social workers more in the high school level. But if we've already taught elementary kids not to talk to these people, or what goes in this house stays in this house, that's not beneficial because they're not talking when they get to high school. We need to start talking at elementary, so when they get to high school they already know how to talk and they can share their feelings instead of being angry and aggressive. But those things are taught, built upon, and everybody doesn't have those skills. We have a few Nanjamoy, the poverty rate I read somewhere is like 30%. So, and Erica said it, schools are supposed to be a community resource. We're supposed to be teaching. So yes, there's things that should be taught at home, but if your parent does not know that and you're like the first year kid going to college, your parents don't know how to fill out a FAFSA. They may not know how to open a checking account. So those are things that we have to teach our kids as a community, because we're building a community. We can't just leave people behind because they don't fit the mold, because you don't know who you're leading. They could be the next Dr. Cook, they could be the next commissioner, but you're just like, oh, whatever, you don't meet this mold. I'm gonna just let you pass you on and send you on to somebody else's problem.
And that's why we run for office, ladies, and that's why we hold these type of forums, because they're needed.
It's important. It's important. I know, Dr. Cook, one thing that you emphasized was the importance of being proactive. Unfortunately, the way our society and even our government works is that we're reactive. We wait till the issue happens and rears its head, even though we saw the train coming a mile away. And then when it happens, then, oh, we have to scramble and figure it out and try to solve this problem when it's preventable. You know, we're seeing these higher levels, like you mentioned, of mental health issues within the school system. We've observed a increase in cases of bullying and fighting in schools. Just recently, we've had mass shootings in school, unfortunately, in that the school Uvalde in Texas. Things like this are happening here in the US, and certain initiatives aren't being pushed forth to prevent this. So it's so important for us to know what our local government is doing, what initiatives are being made. Are people just kind of sitting on their hands and shrugging like they can't do anything about it, when in fact, a lot of this can be prevented? So, what do we do in regards to addressing, for instance, mental illness in the school setting?
Oh, go ahead, and guys.
Just briefly, I think a few things, because we don't have the mental health staff. So my thought is to have paraprofessionals, and pay them, of course, to intervene, network with these kids, get to know these kids, someone that the kids can report to when they see suspicious things on social media, because we have to just, call a thing a thing. Most kids live their lives online. Most kids live 50% of their time, their energy, their creativity, their social network is online. And if we get to know our kids, or if we have someone on the staff that gets to know the social media. I know that we did it when I was working in DC public schools, where that online beef would come into the school building, and you have to sit there and you have to go through the profiles and you have to talk about it, who was threatening who and who did what. If we can get to those people, get to those young men, usually, who are in that kind of danger zone with age, with being a lone wolf, with who are making these posts online, get the children to trust the adults in your building enough to report when they see these things, not tell us after fact, yeah, he made some weird statements 3 months ago and I didn't think he was actually going to do it. Making sure that the lines of communication between young people and adults is open, non-judgmental, and that we're coming from a place of assistance. Okay, I see that you're spiraling and you seem to have some dark thoughts going. How can we address this? Are you experiencing bullying, things like that? Because yes, there are some kids who are way more fragile than others, and there's not a lot of parent support for these kids. They might have parents, but clearly the parents were checked out, unaware, et cetera, et cetera.
Yeah, I'm going to talk to everyone listening as I talk to a patient. I'm an internist. I don't see kids, but we all as humans have the same neuroendocrine pathways in our system. And I'll tell you a little bit about what I mean. I'd mentioned that I'm 52. And when I was in school, we had art class, we had recess, we had home ec. Even after recess, the teacher would sometimes read to us. In elementary school, we had gym. We had a shop class and so forth. So it wasn't go, 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 go all the time. It wasn't stimulation. And when you stimulate the human body repetitively 24/7 or 16 hours of the day, you create a fight or flight. Fight or flight is an old neuroendocrine reflex from when we were battling bears or running away from bears thousands of years ago. Unfortunately, modern human, there's no bear, there's just the stimulation, and it's mental for the most part. And when you stress a human being, a mere mortal, whether physically or mentally, too much, that will break you. It'll break a bone, it'll break a heart, and it'll break your mind. So, one of the easy things that you can do, very easy things you can do, is let a kid be a kid again. Even us adults, adults need to be kids again. Kids laugh like 200 to 400 times a day. They should laugh 200 to 400 times a day. And what do I mean by being a kid again? Get out there and run and play. Put the phone down. Make sure you take some electives. It shouldn't be math followed by English, followed by math, followed by biology, and followed by physiology, and go, go, go. And then homework afterwards. You need to take breaks, lots of breaks, mental breaks. Do art. Watch a funny show. Listen to some music. um, do paper mache, draw, again, run even more because we have a child obesity epidemic as well. Once you start doing that, you start to take the fuel away from fight or flight, and you do not stress the mind. And again, to add to what you ladies have said, we have this epidemic of mental health issues, and Angasa mentioned schizophrenia in their area also. When you stress the mind more and more and more, you will get more type of mental disease. It won't just become anxiety and stress at that point. It will be schizophreniform disorder, um, or mass shooting type of issues and so forth. So we really have to implement these type of general mental health things right at the home.
All right.
Absolutely. I know that the old saying of it takes a village, right? It takes a village to raise a child really is going to be a combination of the schools, the parents at home, the community as a whole, to address these issues. And um, you know, in addition to the mental health crisis that we are dealing with it within the school system, I think another thing that the pandemic exposed was this disparity in education, in resources. I know, Shawna, that's your area of understanding and expertise. You've observed um, how the challenges of the disparities in access to education, the resources that are needed. During the pandemic, you saw that there were children that were virtual learning without internet access, which isn't possible. Right? We're seeing, the exposure of how much of a gap there is in regards to the necessary resources to get a quality education. So, um, what do you think? I mean, can anything be done to correct this now that we again are being exposed to these disparities? What is a possible solution to turn this around?
So of course, because I hate when people are like, oh, you can't do that, or we don't have no choice. We need to do something. So if you look at the iReady scores, so from they did the test and it's from kindergarten to eighth grade. And just overall, it's like 65, 70% of the students tested below grade level. So that means about 30% are on grade level or above. So, and people are like, oh, it's COVID, it's COVID, it's COVID. No, if you look at the numbers from 2019, that was before COVID. So COVID just pushed us farther behind. So it wasn't just COVID just made it worse. So we've had a problem for a long time, and we love to be like, yes, we got 94% graduation, and it's mind boggling because I don't understand how you go from 70% of your students can't read and write to 94% of them graduating and going off to college or wherever they're going. So we need we need all hands on deck. So I get it, and I totally understand teachers are burned out and tired, and I totally respect that because they've had a very hard year. You know, just coming back, we had some students have never been into a classroom before, so this is the first time they've ever sat in a classroom because they started kindergarten virtually. So we have all these disparities. So we need all hands on deck. So if we need to reach out to the local community, because like La Plata, here in La Plata, they just opened a tutoring session. Hey, the community. Hey, you have a tutoring section. Can we send a couple kids there? Hey, the kids have come back. I've had numerous parents come to me and ask me, hey, my kid just came back from college. They don't know what they're going to do. They're bored. Do you have something? Do you know about some internships? Do you know about some jobs? Hey, get those kids to come in here and peer tutor. You're a math major. Come on in here. Teach these kids some math. Oh, you do science. Come over here and let's do this science. We have to figure it out. So just being like, oh, that's not gonna work. We need more money. Okay, there's funding out there. The state had a $6 billion surplus. Yo, can we get $1 billion? We need to teach our kids because this is not working. So to just put our heads in the sand and be like, oh well, this is not going to work. We need money. Okay, our kids deserve it because all we're doing is sending kids into the world that are not prepared. And we already know 50% of all, when kids go to college, freshmen go to college in the fall, 50% of them are not graduating from college. They're going to drop out. So if we make sure that they can read and write, have some type of certification, then they can say, yeah, maybe this is not for me, but I'm going to go be an HVAC. And it's been 90 degrees here. So I know somebody's AC went out this week. They were calling somebody to come and get that fixed because it was hot. So, and my son, he went in next door and put the lady's air conditioners in her window. He's 14. But that's what he wants to do. He wants to be a mechanic. That's what he wants to do. That's his goal. He was like, I might go to college, but I really want to be a mechanic. So that's why I want to be. I want to be a certified mechanic. Also, there was a question in there. So Erica, just to let you know, commissioners run at large, so it doesn't matter what district you live in. You can vote for Ongisa or Dr. Cook. So
vote
just
for me,
FYI.
Erica.
Yeah. So
I will be on your ballot.
Yes. So
please.
only people that are running by district is the Board of Education. So if they're running in District 1, you have your people. You only see the people in District 1. I'm running at large, so I'll be on everybody's ballot. I just wanted to clear that up real quick before it kept scrolling up. Just let everybody know.
Yeah. So it's important that we get out of the idea of the status quo. This pandemic has changed the way this world works and how we do things. I know I come across many patients who are even still, working from home virtually, in companies that never imagined that they would have to have their employees work from home, but here we are, right? Or they would say it wasn't possible. So now we're seeing these issues come up, and we really have to come up with novel ideas and a different kind of thinking out of the box to solve them. I know one area that tends to get ignored a lot is our environment and what we call environmental health. And that's addressing things like pollution, expansion, housing, infrastructure. Basically the environment in which we live and how that impacts our overall health and our, the term I like to use, community wellness. So I know this is one area, Dr. Cook, that you've addressed, even in your platform, about the importance of really paying attention to our environment and how that can impact our health. So I guess explain what is an environmental health and why is it important?
Yeah, when I am with a patient and we're doing a physical, we're talking about their health, their environment has to come up because that is what they are using to sustain their lives. And I unfortunately have to tell patients all the time that we live in a very, very, very polluted world. New England Journal of Medicine did a study, 2016, said that it cost us $4.6 trillion yearly, and 1 out of every 6 people die of a polluted-related illness. So, you got to factor that in. You got to factor that into how we are, as a race of people, more prone to live near a polluted area like a coal plant or a power plant, and how that affects us as well. So, me and Ongisa have been working with this airport expansion and how that airport expansion has increased lead around people of color in schools, which are predominantly made up of people of color as well. And that's a fight that we're still fighting. And when you talk about climate change and environmental health and justice, you're actually talking about the biggest problem in the world right now. There's just no ifs, ands, or buts about it. And so any candidate out there has to talk and has to be talking about that in their platform. If they're not, they've missed the boat, they've missed the ship, and they aren't living in reality. And so I often do talk about the environment, how it relates to your health, your family's health, and the health, more importantly, of our children. Because, I always say there's no planet B. We have to take care of the one we have. And in addition to how polluted our planet is, we are currently living in what is called the sixth great mass extinction event. There's been 5 mass extinction events in Earth's history. They usually happen millions of years apart. This mass extinction event we are living in currently, and a lot of people don't know that, which is the fault of scientists and teachers and doctors and so forth. But we are currently killing off many animal species, including humans, and it's all man-made, and it's been done in the last 100 years. So anything that I can do to help stop that and sustain life and make life, people live longer, and change that trajectory, I will do. And one of my big platforms to help decrease pollution and clean up our environment has been my 70,000 solar panel rooftop initiative, where we can decrease our reliance on fossil fuels, which have decimated our planet, and make money by putting panels on our homes, schools, offices, public and private. Get them on our homes for no cost. Decrease or eliminate your electric bills and have a charging station for your motorcycle, electric motorcycle, or your electric car, or whatever. Use that money that you're making to produce energy to do whatever you want with it. Invest in a new roof. Finance your kids' education, because those panels will produce income for you. They'll produce jobs. They'll produce industry, a large tax base, and it takes power away from the fossil fuel companies, which are one of the biggest lobbying groups on the planet. And in addition to them being a huge lobby, we subsidize them to about 600 billion yearly. So they are what you call socialism for the wealthy, and they are killing our planet for money. And when you look at money in politics, that's another reason why I take zero money, because I think it's the cancer of politics. It's everything we're talking about right now is based on the almighty dollar. And I refuse to accept any special interest money because of my integrity. And I want to show other candidates and lead other candidates that way also.
Let me add to that as well.
Right.
The health issues that we're specifically facing include this airport that's dropping lead on an 88% African American community, but also our waterways are being polluted. A lot of the development that has been going on unfettered by the adequate public facilities regulations. They're supposed to see how this is going to impact our water, how this is going to impact our traffic, how this is going to impact our schools. And our commissioners, unfortunately, have not enforced the regulations through the zoning and what do you call it? Drawing a blank. The department that gives the permits. I'm sorry, Planning Commission. Drawing a blank. So I am also focused on working with the people of Nanjemoy, several dozen families who have no running water, have no septic, who are living in conditions in which any of them and many of them are able to get sick. People who are walking through mud, or their children have to walk through mud to go to the bus stop. People who are not able to get to medical treatment because the public transportation system is such in Charles County that they cannot even get on a Van Go to get to the La Plata Hospital or get to their primary care doctor in an expedient amount of time. And nothing's being done as far as that is concerned. So whether it's transportation, whether it's food insecurity, whether it's having a working septic system, all of these things can directly impact whether someone gets sick or not and how long they're going to live. And so I want to just highlight that. And then also we have a comment in the question or in the comment section. How do you bridge the health gap for those with less access? It's up to our elected officials. It's up to our elected officials to work through our health department to make sure to secure certain grants for people who, if we don't have it in the budget immediately, to work with our delegates and our state senators to get the money into the budget for grants for housing revitalization, for septic systems, building mound systems, getting those solar panels onto their house, because some of them are heating their houses with wood in the winter because they don't have electricity. Their kids don't have Wi-Fi. They tout a public-private partnership with the Think Big broadband service, but it's going to cost the people $160 a month. And people who are not even able to feed their children can pay $160 a month for a broadband? I don't think so. These folks are checking out the little mobile internet from our public library system. So once the public library doesn't have those little mobile internet hubs that you can check out, you're SOL. You're not going to be able to get any internet for your kids to do their homework until the next time one is returned back to the library. So we have so many disparities that our commissioners are well aware of. Most of them grew up here and spent their entire lives here, and have done nothing to really address. Giving a basket of food or a few jugs of water every now and again is not going to solve the systemic poverty, generational poverty that folks are dealing with. And so I plan to work. I already have started, but I plan to continue to fight harder on these issues if I'm elected.
I just want to add,
Absolutely.
so of course I'm remote, but I'm out based in DC, and one of the reasonable accommodation, meaning you can work from home, is pollution. Did you know that in DC? You can say the pollution is too bad that I have asthma, so I can't come into DC to work. That is a reasonable accommodation. Did anybody know that? That's how bad our pollution is.
I
Just to
fill those
give you,
forms out often.
yeah. So just to give you a mind, like I'm like, what? But it's true, and it's been researched. So those are things that we have to be mindful. Also, I have to be mindful that you keep building all these houses, but you're not building any schools. So I live around the corner from Summers, and Summers is 500 over capacity, and I use this expression all the time. If you went to Regency Furniture Stadium and it was 500 over capacity, the fire marshal would be in there and they would close it down, right? But somehow it's a-okay at a school to be 500 over capacity. I was talking to a mom, and they live in Glen Eagle, and there's 9 buses that come from Glen Eagle to go to one elementary school. 9 buses. They have enough kids that they could have their own elementary school. So it's just, they allow you keep building and building. Currently they just knocked down a bunch of land, and they're building 5,000 new houses in La Plata. And the first thing I thought is, where are these kids going to school at? Because you're not building a condo with one bedroom condo. You're building full families with kids that are going to have that 2.9, 3 kids, and a picket fence and a dog. So we're not just hurting our waterways. We're not just hurting, our county infrastructure, our streets, our roads. You're also impacting our schools. And they say it takes 5 to 7 years to build a school, which is mind-boggling in itself. When I can drive down and see a neighborhood up in 2 weeks with grass growing. But we have to think about all those things before we allow continue to grow, because where are our kids going to go? The schools are overpopulated are already. The classrooms are overpopulated. So where are we going to put the students? That's going to, teachers are used to teaching with 20 kids, and now you have 35. you wonder why we have, between the money and teaching and overcrowding of schools, that turns teachers away. So we have to think about all these things before we continue to build.
Population growth is definitely an environmental health issue when you have these great or these expansion projects that don't take into account things like, the availability of schools for the children that will live in these homes. So really understanding, how does housing and infrastructure directly impact public health? Even affordable housing and the impact on the health of the general health of communities. Like, what are your thoughts on the housing and infrastructure and how that impacts our community?
I'll be happy to answer this question first. And this is where money in politics comes in once again. As Angasa was talking about earlier, there's an important document called the Adequate Public Facilities Ordinance that the commissioners are supposed to use to gauge how much and when you can build. And when you get a majority of commissioners in there that have been influenced by developer money, um, and a lot of it, they're going to do the bidding of developers. And they've been doing that for about 40 to 50 years now. And this year, in this administration, not all of them, is a perfect example of that. Despite what we just went over, not having adequate room for students, not having adequate hospital facilities, emergency medical technician facilities, health, the health department facilities, paramedics, police, and so forth. We still allow builders to build thousands and thousands of units. And what happens, as you've said, is we get substandard infrastructure, which means substandard services. And what happens after that is we have to build more and build more schools, which are still way behind, but that costs money, way more money than those extra houses produce in taxes. So then your taxes go up, which they do, and they always do because of these type of decisions. So I always say this type of system is unsustainable, and there's proof to this. Our budget went up about $50 million this year more. A lot of that money came from COVID, but that COVID money isn't going to last forever. As a matter of fact, it'll be gone very soon. So we have to make better decisions and not outgrow or overgrow our pants. Because when we do, we are not sustainable and we pay the price. The only people that really make out like bandits are those fat cats, the 0.0001% people that do this year in and year out. And that's another reason I don't take money from them. And they know that, and they're not too happy with me, but I'm trying to unseat the incumbent right now in my district, who, if you look at his campaign donations, which are public, a lot of donations from developers, real estate lobby, lobbyists in Baltimore and Annapolis, and they pay to play, and it's quid pro quo in a county area just like it is at the federal level. So please look at your candidates that take money from these big special interest groups, and know that if and when you do, you have to give back. That's the name of the game, and those are the people that you see supported by these big fat cats.
Yeah,
I think
it's
just cut it off.
right. Yeah, he most certainly did. I think really understanding how suburban expansion can really impact the community in a variety of different ways, and knowing how the leadership is making their decisions. Is it in the interest of the population, of the people, the actual residents who live in these, or those of developers who are supporting their campaign? And that kind of ties into even the economic situation. We are in essentially a recession. There's inflation, increased cost of living. Just to rent has gone up. Costs have gone up tremendously. So it's impacting families and communities in really big ways. So what do you feel is like the long-term impact of the current economic downturn to families and communities? What are we seeing is negatively impacting our
Um, I'd like to
community?
chime. I'd like to chime in on that. When we first saw the pandemic,
Yep.
interest rates dropped, and a lot of people started buying houses. And of course, the developers reacted by throwing a whole lot more houses out there, raising prices and everything. What we saw is a lot of people sell their house and not even be able to compete to get into the next house. So we saw people bundling up with family members, staying in hotels, et cetera, et cetera. And those are the people with money. The people without money are seeing their rents go up by $500, $600, $700 a month. We're seeing landlords passing on the increased property taxes to their renters. We're seeing the cost of home ownership here, even for people who have paid off their mortgages. They might not even be able to afford the taxes on the houses that they own outright. And so we're pricing people out. And we have a large homeless population still that lives in the woods. We have people who are in small tent communities behind the Walmart in La Plata, the Walmart in Waldorf. There are a lot of people. Like, I used to drive down Chickamuxin when I used to live down that direction and see, gentlemen coming out of the woods in the morning to hitchhike. Because we don't have affordable housing at all. If it's not a 400,000 or more price point, it's not getting built in this county because there's no plan in place for people who don't earn a certain amount of money. It's almost as if our county commissioner's only actual solid plan is that those who don't make a certain modicum of income will be invisible or will be gone. And it's very apparent and it's very obvious. So I just wanted to say that those are health outcomes. We are infested with ticks. We have mosquitoes. We have all kinds of things that can infest a person. And you all are medical professionals. But what I'm saying to you is these folks are living a subsistence life, and several of them are employed. These are not all people who are homeless because they have substance issues or mental health issues or can't find a job. Some of these people are actually employed and living in their car, employed living in someone else's house, employed and living in the woods. It's ridiculous. These are times in which we have no leadership that's going to say, while we have these $400,000, $500,000, $600,000 houses, we also have to make sure that we are building homes that teachers can afford, building homes that police can afford, building homes that people who work at retail stores can afford. There's literally no diversity of price point within this community.
I just want to add, like, I remember when I was looking for a house and and there was three teachers and they all lived together because they couldn't afford. And this was a few years
Mhm.
ago, but it was three teachers and they all lived together because they could not afford a place on their own. And also, we have to get in the mindset that affordable housing is not a bad word. So I saw something on Facebook and they were going to make some affordable housing. I don't know, like in La Plata off of Old Washington. And people just like had a heart attack and they're like, no, da da da. And it's like, everybody doesn't want a $400,000 house. Everybody doesn't need a $400,000 house. Everybody doesn't need 5 and 6 bedroom homes. Some people just need 2 or 3 bedrooms. So you have to be a little bit more realistic. And how does these decisions impact kids? Because I see it all the time. There's a bus stop and it stops right in front of a hotel, and that's where this family lives. They live in the hotel, and that's where the bus stop comes and picks up kids. I live in La Plata, so I also see the families. You can really see them a little bit more in the fall when the leaves drop, and you can see the entire um, tent community. So how does that affect kids? I'm getting teased about these tennis shoes, but the truth is I'm about to get off this bus and go inside a tent. I'm about to get off this bus and go and use the bathroom at this porta potty down here in Nanjamoy and go home. But you worry about my tennis shoes. I don't care about that. I have real world problems. So these things affect everyone. And we just have to be mindful that, we want to build a community where everyone can live and be happy and live comfortable and, not outprice out their houses. Someone testified a couple weeks ago about, the property taxes, and the guy say, I already pay $10,000 a year in property taxes. He owns a house down in Andremoy. He was, I don't want to pay more. I already paid 10 grand, and he said, if I was getting something for it, I'll be okay. But y'all don't even come down here and take care of the roads. So what am I paying for? And it looks like sometimes those things come in deaf ears. It's like, what am I paying for? Or people like, oh yeah, when I first moved here, my property tax was 1,600. Now my property taxes are 5,000, and the pays are not going up like that. And that's also another thing is, and say parents are not paying attention to their kids or not. Well, some parents are working 2 and 3 jobs just to make sure they can put food on the table because they have to pay these outrageous property taxes or this increase in $500 a month in rent. Where these are stories we have heard. I was helping a veteran with filling out some VA work, and he said, I'm about to leave the county because my rent went up. I'm 68 years old. I'm on a fixed income. I get Social Security. Even with the increase in Social Security, I cannot pay this increase in rent. So we're going to see people leave the county because they cannot stay here. And hi, Nicole. And she said that was me. Taxes are 4 or 5 times more than when I first moved here. And what are we getting? If you could really justify it, maybe we could be like, okay, we got some real nice schools. We got state of art schools here. There's only 15 to 16 kids in the classroom. Those that have IEPs are being taken care of. And, we have these state of art teachers, and, we have a basketball and a nice gym and rec area in every community in Waldorf. Well, we don't have any of those things. So what are we paying for?
Yes, and let me just say this to everyone who's listening as well. One of the many reasons that I have a elect Shawna Mayon Marks campaign sign in my front yard, I have an elect Ongisa McKenzie campaign sign in my front yard, is that these young ladies, they care about people. They humanize people. They don't dehumanize people. You see us talking about a homeless person just like we talk about a CEO, because everyone's important. God looks at neither one of those two any different, and you can see that in their platforms. My platform from the beginning, and I've been fighting this for a long time, has always been about ending homelessness in Charles County. I've worked with the Lifestyles Group for many years, and the not only is that the right and moral thing to do, but the data shows, and we all know this, that it's actually less expensive to house a homeless person than it is to keep them on the streets. When you house them, you give them a sense of decency. You can do outreach campaigns to find out what type of medical problems they have, what type of mental problems they have. You can see if they have job training or just needed a place to stay while you get them back on your feet. But in addition to that, the initial question was about this recession and or depression, whatever you want to call it, and we see these every 7 to 10 years like clockwork in American history. Usually, with these type of downturns, you need to invest, and you don't invest in concrete when you invest. You invest in the human being. And when you invest in a human being, yes, you're not going to get a return like going to the slot machines right away, but you are going to get a return with decreased jail sentences, decreased people in the court system, decreases in the hospital system. And when you get them training, you will create another tax base as well. But one of the things that I've stated already, in addition to the solar panel initiative that is something that produces, so you can have an extra income for you and save on your electric bill and so forth, is my public banking initiative. My public banking initiative is basically taking our tax dollars out of Wall Street banks, out of big banks, where they charge us fees and outrageous interest rates in order to loan the money back to build all these schools that we need to build. And we put it in our own bank. And when we put this money in our own bank, we can do with it what we want to. And that usually is to invest in your people and invest in your people and getting businesses, maybe buying some houses, maybe building some green homes. I've been canvassing out for months now, and one of the things I've seen is a bunch of homes that aren't lived in and blighted and need to be rehabbed. And no, we're not going to give those to the developers. We're going to give those to some local construction companies who can rehab those houses with some of these public bank low interest loans and make them green and make them affordable. And we can do that over and over and over again, just like the other banks do, except this money is going to stay in our community instead of going out of our community. And that's what you call sustainability, and it's what you call a county that produces something. Because if we don't start becoming producers, we're going to go through the same old game over and over and over again, which is what we just talked about: high taxes, overcrowded school systems, EMS and court systems strained, et cetera, et cetera.
Absolutely. This is definitely addressed a lot of important issues. There's a lot, not only nationwide, but certainly within our county. And it's so important, I think, the role of local and having the right people in place who care about people, who humanize people, and understand the needs of the community, not just about the dollar and cents, but the human capital as well. Um, I feel like we as a community, people are becoming more aware. People are paying attention. People aren't necessarily going to go with the status quo anymore. That has been obliterated. The pandemic has literally changed the game. We cannot continue doing things the way it's been in the past. It won't work, not sustainable. And that comes from all different aspects, from healthcare to housing to education, to the economy, infrastructure. Uh, the way it was pandemic, pre 2020, it's just not going to work with the current state of affairs. So with that said, um, I want each of you to actually kind of give a synopsis of your platform. Of you are new kids coming into races. Um, Obviously a supporter as well. And I really want to kind of hear, what is it that you see as a possibility for our county? What is your out of the box thinking in regards to real solutions to address a lot of what we discussed tonight? So we'll start with you first, Shawna.
All right. So my out of the box thing is CTE. If it would be my goal that every single student that wants to have a trade would get it. And I use the example. I went to Kentucky State University, and Mr. KSU was a barber, and so while he was in school, he would cut everybody's hair, and the which was perfect because the closest city, like Louisville, was like 45 minutes away, and then Lexington was like 30, 40 minutes away. So it was perfect that he could cut hair, and people would graduate and come back and still get their hair cut by him. So he graduates and he becomes a principal at a school in Indianapolis, and he knows kids were being teased about their hair. So he asked the school, can he open up a barbershop, because he still has his license. So he was cutting the kids' hair, and he said like the bullying had like pretty much stopped. He didn't charge the kids, but he would cut their hair. And so those were things that, even though he had this degree, he still had this trade. So if something happens, he could still, he ever get laid off, he still had skills. And that's the goal, especially with 50% of all of our, college freshmen are probably going to drop out. And how many people change skills all the time? So I'm changing skills now, but I still need a job so I can still do that. I was talking to another guy, at the barbershop because I go to the barbershop a lot. I got boys and I get my hair cut. And he said, if you send me send me a kid for 3 years. In 3 years, I have them making six figures as an HVAC guy. I don't know any job out of college you make six figures. I know my first job out of college was $9.50, and that was because I had a college degree. But that is my out of the box things. I would love for every kid to have, to have a trade if they want to have a trade. I would also want, teacher recruitment, but retention also. What do we need to do to ensure that our teachers stay in the county? A lot of them leave because of pay. We don't pay our teachers enough, so we need to pay them appropriately for the amount of work they do. And then my last thing is diversity. The teachers should look like the students they teach. So we need more teachers of color. It's mind, like I guess that's my word, mind boggling that we have 4 HBCUs here in Maryland and we go to Pennsylvania to recruit teachers to come to Charles County. So why don't we go to those HBCUs and recruit teachers to come and teach in our county and give them some incentives? Maybe we need to work with the state and have some type of teacher down payment assistant programs to help them buy homes here, or build a teacher community where they can have some affordable housing, because that's another thing. A lot of teachers said, if I didn't have my husband, I wouldn't be able to live in Charles County because I don't make enough. A lot of our teachers don't live in Charles County. They live in Prince George County because that's where they can afford. So those are my like 3 out of the box ideas or things that I'm going to push for when I get elected. And even if I don't get elected, I'm still going to push for them because I've been pushing for stuff all this time. It's not going to shut me up anytime soon.
That's the spirit. All right, Dr. Cook.
Shawna, you're going to get elected. So I guess I can be general because my platform is broad, and the generalization I'll use might be a good name for this program, and we've already said it, and that is that it takes a village. Whenever you have seen in history of monumental advances and occurrences, it wasn't done by government. It was done by people. It was done by mobilizing and organizing those people and getting together and being like family. That's the history of man, going back thousands and thousands of years. That's how they survived. Ones that tried to go out on their own did not survive very well. We have a outstanding amount of people power, people that love and want to give back in their community. We just need to organize and mobilize that the right way so we can treat all of our neighbors as family and uplift everybody. So I'm going to try to do that with my position. And we have to also understand that a lot of people don't know this, but Charles County is likely and has likely surpassed PG County as the wealthiest minority majority county in the country. That is history. That is going to be looked at in history in years to come. And my question always is to people, what are we going to do with that wealth? Are we going to squander it? Are we going to let someone else dictate what is done with it? Or are we going to take that power as a community and become a sustainable community that produces and gets something back, gets a return on our investment? Because I think that's not happening right now. And there's a lot of money in politics that is the result of that, or results in that. And several of the positions I've already talked about, public banking and renewable energy, will not only take care of the production part in the return on investment part, but they will tackle something that's the biggest problem that we're dealing with right now, which is climate change. Again, if you don't have something that takes care of that, there is no economy, there's no schools, there's no life, there's no food, there's no water, there's no air, there's no us. So we have to make sure that we elect officials that tackle science and believe in science, because some people they believe in Joe Rogan show science, and I've been to many hearings during the pandemic and seen that firsthand. So, that's just the general part of my platform: sustainability, production, community power, get money and corruption out of this government so it can work for us and our tax dollars can uplift people instead of concrete.
Right. Excellent.
Well,
Ongisa?
my big overarching scary idea is to increase affordable housing by creating not only a revitalization of current housing, helping small businesses create in revitalizing our commercial spaces as well, but also to create tiny homes, small footprint homes that are sustainable, and spread them throughout the county so that we're not overburdening one section or another with extra traffic, extra school seats, things like that. So that's one thing. Kind of joining the tiny house movement, making sure that everything we build is sustainable. So that will mean slowing down the developers significantly. The second one is, as Dr. Cook said, investing in people. So putting that power back in the hands of the people. That means if people who don't necessarily have the deeds to their land because of ancestral inheritance, making sure that when we spend money, we're doing it with people first on the mind, not building first on the mind. Investing in our youth, making sure that they have the facilities and opportunities that they need. And the third thing, really, I don't know how to like whittle down such a really broad kind of platform, but government transparency. So ethics, making sure, I know they have a new ethics board, but making sure that we go back through and make sure that there's not a lot of conflict of interest, because we have commissioners, et cetera, who have conflicts of interest between their business dealings, between their relatives, between, et cetera, all these grants, loan programs, et cetera, where there's a lot of cross mixing, there's a lot of favoritism, there's a lot of nepotism in our system, and making sure that we look for those things and make sure that we're spending money wisely. So going through that budget. So that's all under the auspices of ethics and transparency, making sure that normal people know who their commissioner is and what they're doing. So those are my big overarching goals.
Excellent. Thank you all for joining us tonight. If there might be individuals who want to support your campaign, want to contact you directly, can each of you share ways in which people can connect with your campaign and your platform? We'll start with you first, Ongisa. So kind of go as a direction. How can people reach out to your campaign? Facebook.
We have a website, McKenzie for Charles County, and McKenzie is McKenzie. So that's McKenzieforCharlesCounty.com, McKenzie for Charles County on Facebook, and McKenzie for Charles County at Gmail if you want to email me. Thank you for having me so much.
All right, excellent. Absolutely. All right, and Dr. Cook? I think you're on mute. Can you unmute yourself?
My apologies. Yes.
Right.
Thank you again for having this forum. This is the new public square. This is how we are going to uplift our people. And I appreciate the invite, and especially with these two outstanding ladies. There's a lot of love and a lot of energy. I love being around these folks. They make the world a better place. So how do you get a hold of me? I'm grassroots. So I don't have a lot of frills and bells and whistles, a little bit of old school here, but I am public on Facebook. And my my email to my campaign is, let's see here, richcookjrmd@gmail.com. That's RICHCOOKJRMD@gmail.com. I ask that you send no money. What I do ask is that you spread the word, please. If you can let 10 of your people know or just put it on Facebook, that's what I need. Word of mouth. Word of mouth goes very far. If you also would like me to speak to your group or at an event, I do that all the time. That's what I love to do. It's a passion of mine, whether I'm running for office or not. But these next 6 weeks, it'd probably be more about politics than anything. And you can get a hold of me that way, those two ways also. So I definitely appreciate your support with the word of mouth. Thank you.
Certainly. And
So,
Shawna.
yes. So my website is Shawna Mayon Marks for schoolboard.com. So Shawna, SHAWNA, Mayon, MAYON, Marks, MARKS. And my email is Shawna Mayon Marks for schoolboard at gmail.com. And I'm also on Facebook, elect Shawna Mayon Marks for school board. And I am also got a page on Facebook, Shawna Mayon. So I look forward to speaking to people. Bring
Awesome.
your suggestions, your complaints, things that you think I should do. I'm all ears. I like I like feedback. It makes me better. So I appreciate feedback, good and bad.
Right. Excellent. Well, thank you all so much for joining us tonight. I thought this session was very informative, hit upon a lot of important issues. I love hearing your platforms and some of the out the box solutions that you all have. Like I said, times are changing. We need to do things differently. We need a change, especially in Charles County. I'm glad to have this opportunity to talk with you all. Will be available to our audience on replay. We on YouTube through our Eze Health Center YouTube page. So you can share the video. This will be posted on various platforms, also on Facebook. So hope take the time to listen again, share with a friend. Those who are curious about the specific platforms of the candidates that we have here tonight, you can hear directly from them where is and what their passions are. So thank you all again tonight. You guys have a great evening. Bye-bye.